Dr. Aaron Gray is with us right now, and it's our Missouri Orthopedic Institute segment. We do these once a month in the off season. Once we get started with football, then that'll become a weekly thing along with their weekly clinics. But Dr. Gray is kind enough to take some time out on the road, which seems to be where everybody's at right now. But on the road, heading down for a conference. Correct? Is that where you're on your way?
Yeah, heading down to Nashville. That's correct.
Okay, because you just got done with the conference, right?
It's a busy time. It's a busy time of year. Kind of after football season is where they get all these together real quick.
Yeah, and if I remember some of the tweets that you had, this was more of an esports conference that you just got done with. What was there something weird and wonderful about esports that you learned out of this one?
Well, it's kind of nice. Yeah, it was a conference for sports medicine physicians from around the country,
Mm-hmm.
but with the popularity of esports and how it's growing, we've started to have a segment here or there on that, and thinking how we take care of those quote athletes. So I think it's kind of an interesting topic.
It is an interesting topic, and I would love to dive into it more, but I'm being waved off by all the suits, Penguins, and George. So we'll move on to other things.
Not necessarily. You can ask a question. Feel free. It's your part of the show too. I just have the on-off button.
I know. I understand. So I saw some of your tweets as well, and it was interesting. And how does that when people are addressing that, are they addressing the need for whole body athleticism, kind of like how people used to look at golfers and some of the less active sports? Is it going through the same stages of evolution with esports?
Yeah, well, I think with that, you have to think about just how you can keep the mind sharp and focused. And if you think about ensuring that sleep is good, it's actually interesting if you look at sports like archery and riflery. They work really hard on lots and lots of cardio, just trying to keep their heart rate down in intense situations, because that affects, their aim and their targeting. And so I think that there's a lot of ways that we can take principles learned from other kind of accuracy, high pressure sports and apply it to sports like esports.
Dr. Aaron Gray with us here on the Closers, the other thing that we talked about this, I think it was probably just about a year ago or so. It was just getting kicked off, and that was the Human Performance Institute that's over associated with the Missouri Orthopedic Institute. How has that come in that year plus since its launch, and where do you see it going?
The Human Performance Institute, or HPI as we call it for short, really does have a lot of unique programs going on. And a lot of people don't realize the variety of things that go on there. So we have a program that is actually a boxing program, like against punching bags, for patients with Parkinson's disease that has shown great benefits. We also have youth sports programs working on increasing speed and agility, injury prevention, and athletic performance of youth athletes. And one of my favorite things we have going on there is a program that's working to increase the throwing velocity and health of arms for some of our local softball and baseball players.
How do you do that? Because that's one of those where you've got kids that are on pitch counts, which that's kind of a loose guideline, it seems like, because they don't count warm-up throws or anything like that. But how do you do that and then also work with them on throwing in the correct motion so that you avoid injury?
So a lot of that, for the young athlete really is working on what we call their whole kinetic chain, which is basically just the strength of their legs, their hips, their core muscles, all the way up to their arm. I see a lot of high school guys who just want to go and work out their beach muscles. So they just want to do like bench press and curls all day. And really for a good thrower, you've got to have a lot of upper back and the back of the shoulder muscles. And so we work a lot on that basic strengthening, and then also incorporate some things that have kind of been made famous by the Driveline in Seattle. And we actually use Driveline plyo balls and weighted balls and some of their equipment to train our local pitchers. And for all Royals fans, Driveline, that's going to be familiar when they think about Kyle Zimmer.
Unicorns. Okay. All right, good. Kyle Zimmer once again working his way back from back up to from the minors to the major leagues one more time here. Dr. Aaron Gray with us here. we've talked a lot in the past about elbow injuries and all the rest of that, and Tommy John is one of those things that is most feared. I know Salvador Perez underwent that earlier this season, but an injury popped up. This is Wednesday, earlier in the week with St. Louis Cardinal outfielder Tyler O'Neill. It was a ulnar nerve subluxation. First off, that sounds incredibly painful. Secondly, how does something like that happen? And then what's the, at least for the layman anyway, how do you take care of something like that?
Mm-hmm. So, the ulnar nerve is a nerve that kind of goes in the back, inside of the elbow. A lot of people, if you've kind of gotten hit there, you might call it your funny bone. And so it does sensation for your pinky finger and your ring finger. And so in some people, that nerve actually can kind of slide back and forth. And at times, if that happens, it can become extremely painful. An interesting thing in pitchers that have Tommy John surgery, a lot of times they used to have problems with that nerve. And so James Andrews is made famous. And during that Tommy John procedure, they actually moved that ulnar nerve to a spot so it doesn't do that sliding back and forth.
Okay, so now with O'Neill, he said he felt something, a twinge, and they examined it. What's, for a professional baseball player then? It's not a tear. It's not the UCL tear, which gets you the Tommy John surgery. But how do you rehab from something like that?
That nerve probably is very inflamed, and so often at the beginning you're probably doing things like anti-inflammatories, maybe even some steroid, not Barry Bonds steroid, but anti-inflammatory steroid type of pills to help out with that and calm it down. And then after that, it'll gradually work back his range of motion. And for him, I'm sure strength training is a priority as well.
Are there things physically that athletes can do when it's in season like that, especially for professionals and people that are on a schedule and have groups, trying to not rush them back, but encouraging them to get back as soon as possible, to stay on a strength basis with a limb like that when it's in pain, when it's dealing with something like that? Can they do other things to try and keep that limb in shape while they're waiting for the inflammation and other things to go down?
Yeah, it's kind of that is kind of a unique injury, like George was alluding to. I mean, most of the time you're thinking it's more muscles or tendons or ligaments, and so a nerve issue is a little bit more unusual. But yeah, definitely. I mean, he'll be keeping the rest of his body in shape during that time. Recovery of a nerve issue like that, it's a little, again, it's different than just your typical muscle strain. So it's a little up in the air about how long, that'll take him to get back.
Dr. Aaron Gray with us here on the Closers. All right, the finely tuned athlete right now, we see hamstrings, quads. I know Boogie Cousins the other night tore his quad, and he's out indefinitely. Other sprains and strains and such as that. Is that because the athlete is more finely tuned, or is that because our diagnostic process is that much better?
Well, I think with Boogie Cousins, anytime that you see somebody who's coming back from a major lower leg injury like an Achilles injury, he just has not been able to, go through all the full training and the full strength training and speed and agility that he would in a typical year. And so it's not unusual, after somebody's had a major injury for them to have another injury, maybe in the same leg or the other leg. And so when I saw that, it was, terrible timing for the Golden State Warriors, their players and their fans. But, it's not unusual since he was coming back from such a severe injury.
So, but what about hamstrings and all the rest of that? With working even with the Human Performance Institute, is there a stretching regimen that works best? I mean, you come across some coaches, doctor, that they're like, stretching. It's we're not that big about that.
Yeah, so we used to all, most of us, I would say 20 years ago, played high school sports. We would all get in a circle, do our stretches with a couple claps between. But now we really know that just stretching really doesn't do much for performance, more injury prevention. And so we're much more now into active warm-ups. And there are some specific exercises that have been shown to decrease hamstring injuries called Nordic hamstring curls. If you've never heard of those, I encourage you to YouTube Nordic hamstring curls, and you'll see how hard of an exercise it is. But it's something that you start with just doing a few a day, and then gradually increase that. And they showed in some large soccer studies that would decrease hamstring injuries by 50 to 75% in some players.
It doesn't involve lifting a Viking, right?
No,
Okay.
no, but it's funny. In some parts of the world, they'll call them Russian hamstring curls. Other parts, they call them Nordic hamstring curls. So it just depends what you like.
All right, very good. Question for you as a person outside of this a little bit. When as someone who works for the Orthopedic Institute and the human performance side of things, sports medicine, you're so involved. I know you're also an avid sports fan and you watch a lot of different sports. When you're sitting on the couch and you're watching sports, is there that little moment of trepidation? If you see somebody pull up a little lame or take an extra moment, on the field or on the court, because the brain and the diagnosis side of you goes into overdrive to try and figure out what's going on when you're watching sports generally?
Oh, absolutely. The DVR has definitely, added that instantaneously. You're just like, wait, what was that? Let me rewind that. Let me watch that again. And then too, the other side of me, I know that, that immediately athletic trainers, they're in action, and potentially when you see these severe injuries, you just know that there's weeks and months of rehab ahead with the rehab physical therapy staff, everybody else. And so, knowing that it is we say a sports medicine staff, it's definitely a team approach for that. And so knowing that just immediately when that happens, that they all kind of go into overdrive and they spring into action.
Dr. Aaron Gray, Missouri Orthopedic Institute. Again, you can also look it up online at the Human Performance Institute. It is humanperformance.com, and they have a whole list of services that include, as we talked about earlier on, the throwing velocity program. Then they got the Rocksteady boxing, a lot of things going on, including just the Fit for Health Lifetime Strong. So that's a great bundle of services that are available for the Human Performance Institute. I know you got to keep going because you've got a destination to be to by a certain time, but I appreciate you taking the time out, as limited as it was, Doctor. Safe travels to you. And again, thank you for taking the time here this afternoon.
All right, thanks, guys. Always a pleasure.
All right, you're very welcome. That is Dr. Aaron Gray, Missouri Orthopedic Institute. And again, check it out online, Human Performance or humanperformance.com. humanperformance.com. It's a great place to bring your athlete. It's a great place to bring you, even if you're not an athlete. You can get a little extra working out taken care of. We'll be right back.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.